cardiac CT anatomy. First, some disclosures. I have no financial relationships with the manufacturers of any of the commercial products and/or provider of commercial services discussed in this activity. I do not intend to discuss unapproved or investigative use of any commercial product or device in my presentation. Let's talk a little bit about cardiac anatomy via CTA, for example, and I sort of bring up a few images here for general discussion. We all know that the skeleton, of course, is typically very symmetrical. However, the cardiac structures, there's really nothing which is perpendicular to any of the typical orthogonal planes. Everything in the heart is rotated, everything is asymmetrical. It takes a certain familiarity with the cardiac structures to really know what we're looking at in different viewing angles. Here I've taken a sort of an oblique view with a little bit of an angled cranial-caudal orientation to look at the heart by CTA. And we're able to look at the great vessels, the ascending aorta, pulmonary artery, and right atrial structures, and then identify the coronary arteries. And I'll reference the coronary arteries in the left image to what we see the coronary arteries in a comparable image where there's been a little bit of transparency given to the structures so that you can see the course of the coronary arteries and how they move relative to the internal valvular structures, for example. This will become familiar as you begin to go ahead and manipulate the images yourself. But just to show you the familiarity and the fact that we don't have transparency in a lot of these structures that we don't actually see because they're not actually contrast enhanced. Some discussion is important about nomenclature and the standard terminology that we use to describe the coronary arteries. Typically there are three. Typically they take their origin from the usual coronary sinuses off the ascending aorta in the aortic root. We normally have a right coronary artery, a left main. The left main typically is a bifurcating vessel into a descending vessel called the left anterior descending artery, and then a circumferential vessel. The circumferential vessels are either the right coronary artery or the left circumflex, and they travel in a plane which is uniformly perpendicular to the plane of the descending vessels. And for purposes of description, we talk about marginal arteries, and these are the arteries that always emanate from the circumferential coronary arteries. So the left circumflex will have 1, 2, or 3 marginal arteries. The right coronary artery happens to be the right circumferential vessel, and that will have right ventricular marginal arteries. Septal arteries always originate from the anterior and posterior descending arteries. They're called descending arteries because anatomically when a person is upright, these are sort of in the descending position, moving cranially caudally. And the septal vessels all emanate the descending vessels, either the left anterior descending or the right posterior descending artery. Diagonal arteries originate from the anterior descending coronary artery, and these are always called diagonal 1, 2s, and 3s, and each individual patient will vary in the number of marginals, the number of septals, and the size of the anterior descending. In this particular example we're looking at, the left anterior descending originates from the left main and travels all the way and wraps around the cardiac apex. That's not always the case. Sometimes it will terminate well before the cardiac apex. And often in these sorts of anatomic presentations, the left posterior descending vessel will be particularly large and will accommodate that change. But there is always a very nice bundle circulation. There's the descending vessels, which travel in one plane through the interventricular grooves up and down, and then the circumferential vessels, which travel in the AV grooves, atrioventricular grooves, and form a plane of circulation which is perpendicular almost always, unless the heart is severely deformed or compressed in the chest. I would also point out that there are abundant opportunities for collaterals, and that is for blood to move from the left coronary artery to the right coronary artery, or vice versa, from the anterior descending to the right coronary artery, or from the left circumflex to the right coronary artery. And some of these collateral pathway opportunities are illustrated by the red lines that we've drawn into this. A little bit about the anatomy itself. The left image that you're looking at here is a non-contrast study. the particular position in the chest that this scan was acquired is identical to the position of the chest that the right scan was acquired, but the difference being that we've got a contrast-enhanced blood pool. There is some remaining contrast in the structures of the right ventricle, but the true diagnostic contrast enhancement exists on the right side of the chest, so we see the bright coronary arteries over here, for example, the left circumflex seen in cross-section, the apical wraparound left anterior descending seen at the apex of the heart, and the left circumflex over here seen in cross-section. But what I really wanted to illustrate is the perpendicular nature, the right angles that exist if one looks at the image plane going from the base of the heart out to the apex, and the image plane looking at the circumferential vessels here. Almost always, unless the heart is particularly squished or deformed by chest abnormalities or chamber enlargement from a shunt, this orientation of the coronary arteries is very faithfully preserved in a surprising number, actually the majority of cases. You'll begin to appreciate this as you go ahead and manipulate the image yourselves. But I would remind everybody that the heart is in motion, and that the chambers themselves and the valves themselves change depending on whether they're imaged in systole or in diastole. And on the bottom two slides, we have an open aortic and a closed aortic valve, systole and diastole. And the top frames are showing a closed mitral and an open mitral valve acquired in systole and diastole. So let's talk about the individual coronary vessels then. First, the left main. This typically, although not always, arises from the left coronary sinus. It can vary in length up to about 20 millimeters, and normally it's a 5 millimeter vessel in its diameter. And this is typically the parent vessel. There are some times when there is a common origin. The left main is actually absent, and both the circumflex and the left anterior descending vessels arise from the left coronary sinus. But that's not often the case. And this is normally a bifurcating vessel, but it's a hugely important vessel. Because the amount of myocardium that is subtended by the blood flowing down this channel really represents perhaps 2/3, if not 3/4 of the left ventricular mass typically. So we take this artery particularly seriously, and it's nicely rendered in the volume rendered technique that you see on the right compared to showing it on the left. The left anterior descending artery is also a vessel of tremendous importance, largely because it typically perfuses the interventricular septum as well as the anterior wall of the left ventricle. And here we see it rendered in the three-dimensional volume rendered technique in the colorized image here. Much of the associated cardiac structures have been pruned away, so we can see the left main and the bifurcation into the left anterior descending and the left circumflex vessel. And we see one large bifurcating diagonal artery over here. The curved planar reformation technique has been used to go ahead and show the extent of the left anterior descending, and in this particular case, it is a apical wraparound vessel, a very large vessel, and probably much of the septal perfusion is provided by the anterior descending, and on a vessel this large, probably most of the anterior wall of the left ventricle has also been subtended by the left anterior descending artery. The right coronary artery I'll bring up next, and this is actually the first of the circumferential vessels. This travels in a perpendicular plane to the descending vessels. And most of the time, the right coronary artery is considered a dominant vessel because in its 3/3, proximal, middle, distal thirds, as it travels in the AV groove, ultimately it hits the interventricular groove on the bottom of the heart and gives rise to a posterior descending vessel. That vessel may be large or it may be small, but it typically does provide some septal perforating vessels to the inferior septal wall of the left ventricle. It's an important vessel. It's often involved in coronary syndromes, independent of disease in the left circulation. And we typically name these vessels marginal arteries if they come off of this circumferential vessel. And 90% of the time, this vessel is considered dominant if it provides some septal perforators to the inferior ventricular septum. And here's an angiographic example of what we're talking about of dominance. The The actual direct cardiac catheterization is a dominant right coronary artery viewed, and you can see the distal tributaries fanning out on the inferior ventricular surface. And then the image on the right is a direct injection into a non-dominant right coronary artery. And in a situation like this, undoubtedly the left circumflex is a much larger vessel. And rather than being a diseased right coronary artery, this is just nearly a vestigial vessel, contributing very little, if no blood whatsoever, to the main pumping chamber of the left ventricle. So this is a non-dominant right coronary artery on the right and a dominant right coronary artery on the left. And just to speak a little bit about the circumflex, since this is the next circumventral vessel, which typically arises from the left main coronary artery, here we see it presented as a dominant vessel in the middle portion, and there it's typically called a left posterior descending artery. And you can appreciate that as opposed to the circulation that we would see on the right, here we've got that rendered as the third frame on the right, where we have a vestigial small right coronary artery. We have the accompanying large and the compensating large left circumflex vessel, which is in fact the dominant vessel. And there's some easy visualization of that too. And here's a view which really does relieve sort of a sagittal look at the left circumflex coronary artery. We have 1, 2, 3, 4 marginal arteries actually represented here. And again, the left posterior descending vessel is nicely seen. So with this slide, we'll wrap up this particular video presentation, having discussed the coronary anatomy and the naming conventions of the vessels.